I always thought testosterone was, so to speak, a man's domain. I recently learned that it also exists in the delicate bodies of women. Naturally, I asked Dr. Ovidio Benesh, a doctor of medical sciences. Hello?
Hello there. Hello again. Yes, that would be the case if you had a lot of them.
But I have a little.
But you have some, and maybe you have very little. Because many women didn't know that this hormone, testosterone, isn't just for men. Of course, it's known that men have much more, but it's one of the hormones that starts to drop as we age. And not just during the aging process. It drops, well, women don't produce enough testosterone after a certain age, but it also drops if we do certain very bad things to our bodies, certain excesses, and we say, okay, it drops. So what if it drops? Well, first of all, you start feeling tired. You no longer have the energy you once had.
I'm feeling quite exhausted in this particular instance.
Tired,
yes, it's precisely
exhausted.
The very same situation.
It's the same for men too. Women are feeling more and more tired. They no longer feel like doing the things they used to do. It feels like housework is getting harder and harder to do. You don't feel like getting out of bed. You have these mood swings. You wake up and it feels like everything outside is just cloudy. Is it like having excess estrogen in men, right? No, that maybe excess estrogen in men antagonizes their testosterone a bit and throws it off, and then it doesn't react the way it should. We'll see about that too. Look, here is the situation. When a woman's testosterone levels drop below what we would consider normal for a 20-year-old, you know, her overall muscle mass inevitably begins to decrease as well. Summa summarum and more, your skin, which is also influenced by this testosterone, starts losing its firmness. Wrinkles start to appear. Yes, wrinkles also appear due to a lack of testosterone. You start noticing dark circles under your eyes. So besides the fact that you don't feel like doing anything anymore, and everything seems increasingly difficult, it even feels like a struggle just to climb the stairs. It feels like those 2 grocery bags you're carrying home from the market are already becoming too heavy. You might also start experiencing some persistent sleep issues. If you don't have enough testosterone, you stop getting that deep, soothing, restful, and truly restorative sleep, and you'll see that a lack of sleep lowers your testosterone, but low testosterone also directly causes a lack of sleep. Well, consider the skin and then the hair. The hair begins to lose its natural elasticity, its thickness, and its shine, and it starts to become increasingly dull and lifeless. It keeps breaking. It's become more brittle, right? It is starting to split at the ends, and this one too, it lacks enough testosterone. Dark circles appear under the eyes. It feels like even if you sleep less, dark circles and bags start to show up. And what worries all the ladies? Cellulite. Because you start putting on a lot of body fat, as the lack of testosterone reduces the muscle mass that kept your skin looking nice and firm and all that. The skin starts to sag. It sags here under the chin, the jowls sag, you know, down there under the buttocks, and those creases appear, and between the legs too. So all of this effect that we think is due to gravity is actually caused by this interesting hormone.
Is there substitution therapy?
Yeah, that's a factor too, but there are things we can do naturally. Well, you see, your bones suffer as well. The tissue metabolizes and the bones begin to lose their essential minerals. You start to experience painful fractures. You develop a condition known as osteoporosis. Your bones eventually turn quite porous and you lose a significant amount of calcium. That's how your bones and joints, which are also influenced by testosterone, start losing their elasticity, and you begin to have bone and joint pain. You get tired more and more easily, and your muscles do too. Vision can be affected, so there are a lot of things, including depression. Yeah, you're getting more and more depressed, and you don't feel like doing anything at all. Not to mention that you have constant headaches and refuse any kind of interaction with anyone. So your sex life is also affected because your libido is shot for the same reason. First of all, you need to avoid things that destroy your testosterone. It's been clearly proven that, look, if you don't get enough sleep, food, drink, sleep, we'll get to those, but sleep comes first. If you don't eat, if you don't get enough sleep, they say that if you cut your sleep from 8 hours to 6, and I've seen that most very busy women sacrifice 2 or 3 hours of sleep because their alarm goes off and they wake up abruptly. So with 6 hours of sleep, your testosterone drops by 30 to 35%. If you sleep less, it plummets by up to 80%. So pay close attention. Make sure you give your body 8 full hours of sleep, if not 8.5 or even 9, especially between 11 p.m. and 7 a.m. Does that time frame really matter, or can you sleep at other times? It's best to sleep during that window because that's when a whole range of hormones are secreted by the pituitary gland, like melatonin, which stimulates production. Another key factor for a good night's sleep is ensuring you exercise during the day. Don't do it right before bed, but you really must find time to stimulate your muscles. Think of your large muscle groups, like those in your chest or legs, that need that activity. Squats, weight training, you don't have to do a lot, but try to do it at least every other day. Weight training for at least 20 minutes, because by stimulating muscle contraction, you're asking your body to adapt, and one of those adaptations is to secrete more testosterone. After about 4 weeks, after about a month, you will see significant improvements. Another important thing is to avoid toxic excesses. Alcohol inhibits testosterone production. So consuming alcohol, smoking, and indulging in things like those highly saturated fats will consistently cause significant problems. With your testosterone production, it will absolutely plummet, and it really plummets quite rapidly after just 2 or 3 days of excess. So you spend 2 or 3 days in excess, and your levels just crash. After that, it takes another 2 or 3 weeks to fully restore your natural hormonal balance. Your diet should be balanced. If you don't provide your body with quality protein, and pay close attention, because quality protein sources also include animal products, you know very well that they are fed and injected with all sorts of supplements, antibiotics, and hormones, especially an excess of synthetic estrogen. Cow's milk. Does anyone know someone who developed gynecomastia from eating chicken meat, for example? Yes. Now, this was a man who grew breasts. So plastic, you should avoid drinking from plastic because it has certain structures that negatively affect your hormone secretion. So pay close attention to what you cook with, and that includes the water. It's best to drink water from a glass container. Actually, no metal, skip that. How can we know for sure if it's safe? We shouldn't just buy anything. We should buy organic. So we absolutely must buy organic to be sure that at that farm they weren't fed with fertilizers and that they weren't fed and injected with all sorts of things. But we maintain a very strict balance, 30%, 30%, and 30% protein, which means egg whites, chicken, certainly fish, and definitely plenty of broccoli and other fresh green vegetables. So the carbohydrate source should consist of 30% vegetables and 30% of those healthy fats we discussed, specifically fish oil and fats derived from various plant sources that are rich in essential omega fatty acids. Remember, zinc is vital for healthy testosterone production, which is essential for both men and women. Therefore, we should include a good portion of red meat in our regular diets. We also shouldn't go without eating plenty of salmon either. Just be very careful to buy antibiotic-free salmon. Pumpkin seeds are great as you, and think about onions and garlic. They're excellent for boosting testosterone production. Don't forget about oysters, every now and then. Sure, they're more expensive, but onions and garlic are very easy to come by. Let's not forget to get our magnesium. B-complex vitamins are absolutely essential for your health, and naturally, if you undergo blood tests and your physician discovers you are suffering from a deficiency, it is important that they provide you with a supplement. However, you should definitely aim to obtain your B6 from sources like whole grain fiber bread, various seeds and almonds, ensuring they are all raw, unsalted, and unroasted, as well as incorporating fish and chicken into your diet. B12 is absolutely essential for testosterone production, and a deficiency can lead to some very serious health problems. Also red meat, fatty fish, whole eggs, meaning with the yolk, at least one whole egg every 2 days, a hard-boiled egg. Likewise, vitamin C complex is important. Broccoli, all those colorful things like red peppers, green bell peppers, red, yellow, all the colors, a pomegranate, at least one pomegranate a week. In a similar way, it will also make your testosterone receptors much more sensitive.
Thank you very much to Dr. Ovidiu Peneș, Doctor of Medical Sciences. We will stay young and beautiful if we know what to eat and especially what not to drink.